Hi there and welcome to lesson 6, where we're going to talk about what to expect after your vision correction procedure and the specifics of aftercare. So immediately after all vision correction procedures, all patients experience the same thing, which is foggy vision. It's entirely normal. And the level of foggy vision that you should expect is that you should be able to quite clearly see the room, the shape of the room, the chair. You should be able to see the person in front of you and to recognize them, but there will be a fine mist or a fog over the vision. Some patients can read their mobile phone, but in general, for the first few hours, patients are not able to see text on a mobile phone. It's very, very important that you've had the chance beforehand to hear this from your surgeon and to understand that in their hands and with their technique that they're going to do to you, what level and speed of visual recovery you can expect. As I say, most patients have that level of fogging I've described, and the period over which it slowly improves and gets better is 12 to 24 hours. So for many patients after vision correction procedures, the afternoon following or the evening following the procedure, they're noticing that the fog is genuinely starting to disappear and things are becoming clearer and clearer. Definitely by the morning following the procedure, you should wake up and you should find that really there's very little of the fogginess remaining. But fogginess of vision is only one aspect. The other aspect that we need to be aware of following vision correction procedures is the comfort of the eyes. And there's a whole array of minor symptoms that patients can describe to us. Some patients describe a little bit of glare off computer screens or off their mobile phone. But the most common one is a sensation of a pricking sensation or a feeling of a hair or a piece of grit in the eye. It's incredibly common. And generally it only lasts a couple of hours following the procedure. If at any stage you experience severe pain or severe redness or severe deterioration of the vision, you really must not stay at home hoping it will improve. You need to contact your clinic, and this is another very important point, is that you must have 24/7 access to a member of the clinical team, and you must have an emergency number to call should you need it. So if you notice severe pain, if you notice any more blurring than I've described, or if you notice that rather than clearing, that the fogginess or blurring is getting worse, or if you find that the eyes are getting more and more red following the surgery, you must use the emergency number and call the on-call team. I think that many surgeons provide the patients with directly their own number, and that's something that personally I like to do, because I think that it gives the patient a real sense of reassurance if they know that they can directly contact their surgeon following surgery. And lastly, I think that it's very important that if your surgeon is going to be away or on holidays any time after your procedure, it's very important to make sure that they have arranged cover and someone to be able to look after you in the event that they're not available. Now, when I talk about needing to contact your surgeon in an emergency or these worrying symptoms after surgery, I'm not trying to worry you. In reality, the number of times over the last 10 years that I've received an emergency phone call from a patient, I could count on 3 fingers. And I think that it's important to remember that. I think what it's about is having the reassurance that in the event that you're one of the very, very, very rare cases where there is a complication or is a problem, that you have the access to immediate care, so that problem can be addressed immediately rather than you being stuck at home and trying to struggle to find access to the clinic or to someone to look after you. So in summary, I wanted to highlight 3 really key important points when it comes to ensuring safety after surgery. The first is you need a dedicated emergency contact number through which you can contact your surgeon to be able to discuss anything that you feel is outside of what's been described to you as what should happen. The second is that if you feel there's a need to have something checked in between the prescribed pre-arranged appointments, then there should be a way of you being able to see your surgeon at short notice rather than having to wait another week until your next appointment. Lastly, the third thing is that there shouldn't be a harsh cutoff after which you can no longer see your surgeon. There should not be the case that your treatment ends 6 days or 7 or 12 months after surgery. There should be an ongoing commitment to your care, that if you have a concern at any time after the surgery, that the clinic will see you and be able to advise you on whether or not there's anything to be concerned about. If you'd like to know more about vision correction surgery, then book a free initial appointment today and I will personally answer your questions.